Okay, hi everyone. I'm just waiting for a few more people to join and then we can get started. So just bear with me 1 or 2 minutes while we wait for some more people. Okay, I think we'll get started now. If anyone else wants to join, they can do so. I might, just recap what we talked about in the beginning. But the first few slides, just a bit of an introduction, so you shouldn't miss much if you did turn up a little bit later. So today's session is on standing out amongst other applicants. So what to do to basically make your application a little bit more unique compared to other people, so that you're more likely to be successful with these medical school applications. Okay, so before I go on to the introduction slide, I'm just going to talk a little bit about myself. So my name is Ruthie and I'm a 4th year medical student at Bristol. I intercalated last year in Imperial and now I'm back in medicine, so the last 2 years, and then I'll be graduating next year. Basically what we're going to cover are things like what are you going to do before applying. Then we're going to look at the UCAS application itself, especially if people don't really know much about it. We can talk about that, and then how the interviews works, and then ways in which you can try and stand out and make your application a little bit more unique to other people's. So what's the reason for standing out? Obviously, one of the main things is the competition. So for each place, roughly there's about 10 applicants competing for that space. So medical school does tend to be quite competitive. And I think in the past few years, it's gotten even more competitive than it used to be. Just because more people seem to be applying for medicine in general. And also in terms of the way they are looking at applications, has gotten a little bit more difficult. Like the UCAT, some universities weigh it a lot more than they used to. And obviously they're also thinking about changes like, scrapping the personal statement and changing it into questions. Because of all of these things, it is getting a little bit more competitive to get into medical school. So of all of these applicants who are applying, obviously everyone is clever and everyone has the grades and everyone has done a lot of things in order to try and pursue medicine. So what makes you different? And that's why it's really important for everyone to try, I guess, a little bit try and stand out and show your uniqueness a little bit more, so that the people who are assessing your application, seem like you stand out to them. Basically, that's kind of what we're trying to get at. You're all also caring, so there's a certain type of personality that goes into medicine and they want to help people, and they're all very knowledgeable. So because this is a common trait amongst everyone else, again, this is another reason why you should be trying to stand out as much as you can. And it's also quite a short time in which you need to show that you're shining. So from GCSEs all the way until A levels, it's only 4 years, and in that time, you need to do a lot of work experience and things like that. Also, different universities want different types of doctors. So for Bristol, for example, when I was applying, there was a very heavy focus on, trying to understand the importance of empathy and making sure you have the soft skills just as much as you have the medical knowledge. So what they were trying to see is, do they have the personality type to be able to empathize and have those good communication skills to be good doctors? Because just knowing about certain medical conditions isn't enough. You also need to actually be able to relay that to the patients and provide that patient-centered care. So being robotic and just knowing the different conditions and what medicines to give people is not enough to be a doctor. So you need to be quite well-rounded. Okay, so those are the main reasons why you need to consider about standing out. So how can you stand out? Well, one of the ways to do that is work experience. Obviously, most people will do work experience, and that's one way of also finding out more about the career yourself to decide whether this is actually suitable for you, or whether actually, you know, this is completely different to what you thought it would be and you don't want to do it anymore. So it's a way for you to explore whether that career suits you. But the second thing that work experience shows to the interviewers and also the application reviewers is whether you have a commitment to medicine. So a lot of people may do just 1 week of work experience or a few days of work experience in one arena, but what it's important to do is to try and do it in different settings. So whether that's in a GP practice plus hospital work experience as well, or whether you do something abroad over the summer, or whether you do some sort of volunteering in a care home, or working as a healthcare assistant, or working in a pharmacy. And all of those will give you that well-rounded experience to really understand how healthcare is quite a multidisciplinary profession. So yeah, one of the work experience you can do is obviously experiencing healthcare itself directly. So that's where the GP practices and the pharmacies and the secondary care and all of that comes in. But then we also have some other things as well, which I'll go into in a little bit. So there is a little link here if you guys want to have a look later. I think these slides should be sent out to you after the session. But essentially, obviously, because of COVID, we have found that students are finding it a lot more difficult to get work experience. But I think things are opening back up now. So you should, I think, universities are also expecting you to start being able to find your work experience again, because there's not as many restrictions as there used to be. So contact work experience people very early on, and make sure that, you know, you try and get a range of experiences. So yes, it can be in just one department or one area of healthcare which interests you. For example, if you're really interested in learning about the heart, maybe ask around about cardiology placements. But if, you know, it's so limited that you can only see a specific type of department that's not necessarily of interest to you, it's still useful, only because you might not know much about all the different specialties in medicine. I certainly didn't. I didn't know how many different types of doctors there are. So it's just good to just have a general understanding of what the hospital is like, how it runs, what kind of day-to-day job a junior doctor does. And that's how you find all of that out through work experience, regardless of which setting you're in. Obviously, there's online, you know, virtual work experiences like the Brighton and Sussex ones, which were launched a few years ago, I think during COVID. But there are also some really well advertised ones, particularly in London. The London ones are a bit difficult to get into. That's why I'm saying, like, get in touch with them early on. So for example, if you want something in October half term, try and get in touch like March, April, so around this time, because spaces do fill up. And then obviously sometimes medical students also want to do like electives in other hospitals. So they obviously would take preference over, you know, people applying to medicine. And that's why it's important to get in there early. So the things you can do is maybe think about your local GPs around you, and just shadowing them for a week and trying to see what their day-to-day is like. With GP work experiences, you can do shadowing the GP themselves, but you can also shadow the nurses and the healthcare assistants, because they do have a very big role in terms of what they do. If you can't seem to get work experience, a lot of GP practices tend to advertise for receptionist jobs. So you can do that as part-time work alongside your A-levels. And yes, the receptionist role doesn't have that much sort of where you're sitting in with a GP and, you know, seeing the consultations, but you will have a lot of patient contact and you will learn all those communication skills. And then you will learn how a GP practice runs, which is also useful knowledge. And then now and then you can, you know, have conversations with the GP about your career. And by having a part-time job there, you can also develop that long-term relationship with those doctors and nurses, and really get an insight into whether you want to do this job in the future or not, like being a GP or being a doctor in general. The other type, the obvious one, is obviously hospital work experience, and I've already talked a little bit about that. The other things you can think about is hospice and elderly care homes. I'd probably say elderly care homes are a lot more open to taking in students who want to pursue medicine or who want to work as healthcare assistants compared to a hospice. The only reason is because hospices are where lots of people are nearing the end of their life. And therefore they may not want to have a lot of different people around these patients because they are very, very unwell, and they'll have family around them to support them with the dying process. So I think it's a lot easier to get placements or part-time work in a care home compared to a hospice, but obviously try both because some people have managed to get hospice placements, and that will definitely be a good experience. It can be quite emotionally challenging, but it does teach you a lot. As I said before, you can get a job as a healthcare assistant. We're always told as medical students that whoever has done healthcare assistantships prior to coming to medicine or whilst they're studying medicine, doing it as a part-time job, always tend to be better doctors than the ones who don't. And the reason for that is you're communicating with patients all the time, and you develop those soft skills that you don't really tend to develop otherwise. So healthcare assistantships, a very, very good way of understanding how the hospital runs, but also you also get it's a hands-on approach, a way of understanding how medicine works, and you can also understand the team, the multidisciplinary team, because you will be part of it, and you'll be the person sort of helping clean the patients, feed them if they struggle, if they've had strokes, for example, and you might also be helping them with things like their daily medicines and doing their observations, so things like checking their temperature and blood pressure, and checking their heart rate and their respiratory rate and things like that. So general checkups every few hours, you'll be doing things like that, which are all skills you learn as a medical student as well. Vaccine drives. So I think some students, it depends really. I think you do need to go into a little bit of training before you do this, but you can get involved in things like vaccinations, particularly since COVID. I think this has been quite big, and also it's a part-time job, so you also get some money from this and the HCA job as well. You can do something called virtual theatre experience. So I don't know much about these, but I think they are quite informative because they tell you what happens during surgeries, and I think at the moment they're not really allowing a lot of year 11, year 12 students to come into theatre, but it might be a really good way to do these online experiences to understand how surgeries work and what kind of preparation we need to do before operations on patients. So it might be a good way to find out a little bit more of sort of the surgical side if that's something you're interested in. So why is it really important to try and secure some work experience in healthcare? Obviously, it's very different to being a patient. So one of the reasons why you might want to have studied medicine is because you were a patient and you've experienced really good care from doctors. Whilst this is a good reason to maybe state at the start of your personal statement, it's not going to form your whole answer as to why you want to study medicine. So you need to try and get that healthcare experience to try and actually understand what it's like doing the job compared to being a patient. You can also experience the MDT. So MDT essentially stands for the multidisciplinary team. So it's a little bit different to other jobs, the way medicine works. We all sort of, I guess, in a way, have an equal footing. So doctors, nurses, physiotherapists, occupational therapists, dietitians, nutritionists, we all sort of work together in order to help the patient get better and help direct our care towards the needs of the patient. So really trying to understand what the MDT does can be really useful. Attending MDT meetings can also help you learn a lot about the way we manage patients as well. Experiencing healthcare also obviously helps you understand the role of a doctor, but not just the general role of them, but also the day-to-day life of what kind of jobs a junior doctor might have versus a registrar versus a consultant. And it will just show you that sort of career progression that you will experience in the future once you become a doctor as well. So what are the jobs of a junior doctor compared to the more senior doctors, is a very useful way of also deciding whether you actually want to do this career or not. And again, understand the lifestyle. So I think it's sort of a little bit of a thing in the media that we, because doctors work certain types of hours, that we don't really have time to do much other things other than our job. I don't think that's entirely true. I do think it's a little bit of a stereotype. It does depend on what type of specialty you go into. So obviously, if you go into certain types of surgery, like general surgery and obs and gynae surgery, it tends to be a lot heavier workload compared to other specialties like medicine, for example, like dermatology, so skin stuff, or rheumatology, bones, and autoimmune conditions. So I think it depends on the job you go into and the type of personality you are. So there's something for everyone. So I don't think it should discourage you when you see in the media that, oh my God, they're working all the time, they don't have time to do anything else. That's not entirely true. It obviously depends on the specialty you want to pursue. So I try to understand the lifestyle and take it with a pinch of salt, whatever is being said in the media. Also, it shows that you're being quite proactive if you go and try and find your own healthcare experience, and you're also trying to explore your career right from the start, even before you get into medicine. It's really good. It's a good skill to show your interviewers. So those are some short-term experiences that you can do. So healthcare experiences, which you can do for 1 or 2 weeks as an attachment over Easter or October half term or the summer, or the Christmas break. Some longer term experiences, which can show maybe a commitment to medicine, it obviously depends on what's available and depends on your schedule and how intense your A-level subjects are and whether you can manage it or not alongside your extracurriculars. Not everyone tends to take on a lot of long-term work experiences, but if you can, obviously it's another way to stand out in your application. So simple things you can do at school, for example, in terms of things, I guess from what I can remember, what I did, we set up a medical society in our school, and everyone who was interested in doing medicine, we sort of did like a journal club every week where we discussed like an article that's currently in the media, which was medical related. And in a way, it's really good because all of you are applying for medicine, and we were sort of helping each other try and keep up to date with what's going on in healthcare at the moment, because those are common topics that can be asked in interviews. But it's also a good way of showing your commitment to medicine by setting up that society, because it shows that you're spending some time of your week trying to really understand like what the most current issues are in healthcare. The other thing is tutoring. So I don't have personal experience of doing this when I was year 11 or year 12, but I did start doing this once I got into medical school for you guys, so helping you get into medical school. That's the kind of tutoring I do. But if you can start doing it maybe in year 11 or year 12, like tutoring year 7s, or year 6s do 11 plus exams, so teaching them maths and English, and stuff like that can be really useful in it, because teaching is a really important skill to have even when you're a doctor, because regardless of what level of doctor you are always teaching other people. So if you're a junior doctor, you might be teaching medical students. If you're a registrar, you might be teaching junior doctors. If you're a consultant, you might be teaching the registrars and the junior doctors and the medical students. If you're a medical student, you might be teaching younger medical students, or like me in this case, so year 11, year 12 students. So teaching is a very important skill to have because it will follow you lifelong in this career. So tutoring is a very good skill to have. It also develops sort of your sense of communication skills, your teamwork, your organization skills, because you might need to do some lesson plans before you do the actual teaching. So it teaches you a lot of transferable skills which are relevant for medicine. Of course, you can do some paid work. I think I touched on this briefly. So working as a healthcare assistant, whether that's in a care home or in a GP or in a hospital, doesn't matter, whichever you can find. Just bear in mind that healthcare assistantship hours tend to be quite long. They tend to be 7 a.m. to 7 p.m. So if that's not feasible, please don't take on a job like that, obviously, because the last thing you want to do is affect your grades and then not be able to get into medicine at all. So, be careful when you're thinking through what kind of long-term experiences you want to do, and try and do ones that you can actually manage. and don't outstretch yourself. Other things you can do is, like, as I said, GP receptionist. Usually those GP receptionist jobs are just Saturdays and Sundays, and you can just say, I only want to work Saturday mornings or Saturday afternoons, and do like a half-day shift. Obviously, depending on the job specification, if that fits you, then definitely apply to those, because you will learn a lot. GPs also advertise for medical note summarizers, where you summarize the medical notes about certain different patients. It's a good way of learning what kind of medical conditions there are, and then you can go and look them up and try and build your knowledge, which you can then talk about in interviews as well. So that's another good job to think about. And then working in a pharmacy can help you understand medicines, and it can also help you just in general understand what kind of medicines we give for what kind of medical conditions, which again, you can use in your interviews, and discuss the importance of pharmacists and local pharmacies as part of the healthcare system. Other things you can do are volunteering. There's lots of different types of volunteering you can do. Doesn't necessarily have to be medical. Same goes for the paid work. The paid work doesn't have to be medical, because regardless of what work you're doing, you're developing those transferable skills which you can use in medicine. So some of my friends used to work in WH Smith, or they used to work in the other retail centres, or in restaurants, and you still use those communication skills and those teamwork skills in medicine. So you can talk about that as well. And it also teaches you a lot of independence and understanding of finances. So again, just general life skills is very useful. Volunteering, so medical specific ones, you can volunteer in a care home, just turn up, once a week to speak to elderly people, provide them some company, or you can do it through charities. So I did it through Age UK, and you can do a little bit of work in the Age UK shops, and then a little bit of work in the care homes. So you can split your time in that way. There's also things like volunteering in a hospice. Again, that's quite a difficult one to get, but if you can, obviously that's amazing. And then other things you can do, volunteering in so teaching children in schools with learning disabilities, so once a week, if that's something that's available to you, that's something you can try and pursue. Yeah, so there's a vast variety of things. One of the volunteering things that I did during the October half term of the year that I applied was something called Revitalised, which is a volunteering company where you go and stay there for a week, and you help elderly people or people with learning disabilities with daily tasks like eating, just giving them some company, helping them mobilize and walk, and then usually they have one day where they go on a day out, so you can help them shopping, you can just go and have food with them, you can do different activities. So I think one of my friends, so I took a lady shopping during the day, whereas one of my friends, she took the person she was assigned to, they went on a day cruise thing, because the Revitalised volunteering I went to was run in Southampton, so they did a day cruise and then they came back. So it's like a day out, depending on whatever the person you're caring for wants to do. And then obviously you have to do certain duties that I think you get put on a rota. So you get kitchen duty, you get just spending time with them whilst they're watching TV, or you get bingo duty in the evenings where you're the person saying the numbers for bingo, and it just teaches you all the communication skills and also helps you understand the medical conditions they have and what kind of I guess barriers to their quality of life they have, and it will also give you an insight of what kind of things you can do when you become a doctor for these people who may have a lot poorer quality of life compared to other people who are able to be independent and do things by themselves. So yeah, the Revitalised I thought was really good. I definitely recommend for people who do have the time to do it. You can do it in the summer, or for me, I did it in October half term. So depending on whenever your schedule fits. Again, helping in the community, that can be any type of volunteering, where if you're religious, for example, it could be volunteering at your temple or your church. It can be being part of the community choir, it can be anything. So why is it important to have longer-term experiences? As I said before, it shows that commitment and that dedication. It also shows your compassion towards helping people in the medical career in general. And it develops your social skills. And social skills are really important in medicine because, as I keep saying, you are talking to patients, that's your day job. So being able to communicate medical jargon and medical language in a way that patients can understand is a skill in itself. And you first start developing that with these longer term experiences and your social skills. It also develops your own confidence, just speaking to different groups of people that you may not come across normally in school. And it just helps you develop your confidence in that. And as I keep saying, it helps with your transferable skills. Okay, so those are the specific work experiences that we've gone over. There are some other things you can do as well to make yourself stand out. So one of the things that really shows off people's personalities is their hobbies and passions, because everyone is different and everyone likes different things. And these hobbies you might have been doing from when you were really, really young. And so it's something that you're really passionate about. And it's also something that helps you de-stress from your academics. And this, the reason why you definitely should talk about your hobbies is because it shows that you have a good work-life balance, which again is a skill you need in medicine and beyond. So what other experiences can you do? So yes, prefects. So this is more sort of, I call them supracurricular activities rather than extracurricular activities. So supracurricular activities, I say, are academic stuff which will help you with your medicine application, whereas extracurriculars are things that help you relax. And they do teach you transferable skills, but their main purpose is to help you maintain a work-life balance and de-stress. So prefects I would class under supracurricular activity, same with head of house, same with organising clubs, and instruments I would class under extracurricular activities, only because I think it's more of like a personal hobby. So whether that's you playing the piano or playing the violin or whatever instrument it is, or if you're part of the school band or the school orchestra, again, it teaches you a lot of skills. Sports, so whether that's a team sport or an individual sport, it doesn't matter. It just shows that, you know, you've got that teamsmanship and you're able to, especially if it's a team sport, you're able to communicate with one another to try and tactically win a game, or for example, or if it's an individual sport, it shows your perseverance to continue and get better. So I guess things like tennis or badminton, you still do have partners, but obviously it's more of an individual sport, or running, for example, is an individual sport. And any other hobbies. So I think a lot of people have questions. I've had questions in the past, like, so I do gaming. Should I talk about this or not? Because I think a lot of people have a conception that gaming can be seen in a negative light. I actually think it can be seen in a positive light. So the way I explain it to students is that it helps you build a lot of manual dexterity and, you know, coordination skills, which if you're considering pursuing like a surgical career, obviously it's really important to have those skills. It also helps you with your communication because you might be playing online with other people. So I don't think it should necessarily be taken as a negative hobby. I think all hobbies are good. And if it's helping you de-stress, of course, talk about it. I don't think it's something to hide or be embarrassed about. And then other hobbies are like if you're learning a new language just in your own time, if that's something that you really enjoy doing, if you enjoy painting, if you enjoy going to the gym, anything that is basically some stuff you do outside of academics, I would consider a hobby. Or if you do hiking, or if you do a bit more extreme activities like abseiling, skiing, that kind of stuff, all of that can be talked about. And school subjects as well. So I think what essentially they mean by school subjects is if you're doing biology or chemistry, if you're doing any of the Olympiads, so they usually have a biology Olympiad or a chemistry Olympiad if you're part of that, or the maths Olympiad, or if you've done an EPQ, what subject did you do it on, that kind of stuff. So why is it important to talk about these other experiences? As I said before, the main thing is work-life balance. It's almost like a key word in medicine. And if you show that in your work, in your personal statement, or in the questions that they're going to change it to in the UCAS application, it really shows that you understand that, yes, medicine is a stressful career, but you have that work-life balance already established. So you're not going to struggle with the stress of the career. So that's essentially what you're showing, because the interviewers want to see, can you actually cope with a medical career? Because it is difficult. It's not for everybody, but they want to see if you have good coping mechanisms. And the way to show it is through these other experiences. Again, social skills and organization, and teaches you leadership as well. And it also shows your passions outside of medicine. Okay, moving on to the personal statement itself. The top tips that I can pass on to you guys is reflection. Throughout your personal statement, what they're trying to see is if you're able to reflect on your experiences and talk about what you learned from your experiences. Try and be unique in the way you talk about your work experiences. This can be quite difficult, and I think like when you're starting out writing personal statements, it's always a temptation to sort of try and Google somebody else's personal statement and read through it. I would say, yes, it's good to read through some examples of personal statements, but you do run the risk of sort of copying similar sentences to what they've written. So what I would try and say is plan the paragraphs and what you want to write. There's a really good technique that SixMed use, which is called creating a work experience diary. And essentially what that is every time you've done a work experience, you just write the patient encounter that you had. So for example, today in clinic, I saw a patient who had a skin lesion. And the doctor communicated really well with them and tried to reassure them that it wasn't skin cancer. This really had a lasting impact on them because the doctor was able to show empathy and good communication skills in order to reassure the patient. So it's showing you talk a little bit about what the experience was, but also reflecting on the main skills that the doctor used, which helped create a positive outlook for that patient. I just seem to have a question. Can I talk about being a subject ambassador? Does this count as an extracurricular? Yeah, it should do, yeah. Yeah, that's fine. The next thing to do in your personal statement is sell yourself. Obviously, there is a difference between being confident and being arrogant. I think most people tend to stick on the confident side. So being confident would be things like talking about what you've learned and really reflecting on things and showing the wide array of work experiences and general experiences that you've done to show your commitment to medicine. Whereas being arrogant would be saying, in biology, I've kept getting A stars, so they don't really want to know that. They don't care about that. They already know your grades. Your personal statement is more to talk about your personality rather than just fixate on grades and saying you came first and this, you came first and that. So that would be arrogance or boasting, whereas confidence is just more focusing on the reflection aspect of it rather than just stating what you achieved. With your personal statement, make sure you're clear and straight to the point, and also remove extra words because obviously you're limited by your characters. Please could you also cover work experience from a reapplication point of view? I think it's the same thing as if you were to apply the first time, except the additional thing you need to do is talk about what you've done in that year before reapplying. And in that sort of sense, some people tend to go away they spend 6 months doing part-time work to save as much money as possible, and then the remaining few months they tend to go away to a different country, volunteer abroad, medical related, and do an elective type of work experience abroad, because obviously you have a year to do that stuff in. Or some people just tend to work for an entire year, but they secure a job like working in a GP, for example, to actually insert themselves completely in medicine to try and understand what it's like working there. I think that's the difference. Is the personal statement changing this year? Yes, there have been talks about it changing. I think most likely it will, but we're not entirely sure and they haven't released that information. So I know just as much as you do. I think there is talk of changing it to questions, 6 questions which you have to answer, but not sure yet. How old do you need to be in order to work as a HCA? I think 17 or 18, I can't remember exactly, but double check on the hospital websites. How would you suggest we be unique? Is there some specific examples that you could provide? For me, it was revitalize, because I don't think a lot of people did do that. And it was sort of like staying a week with the people who need to be cared for as well, and then, developing your skills that way. And the other thing I did was, can't actually remember specifically, but I did I went to we had like an anatomy course day where we went and saw a lot of dissections, That was offered through our school, but it was not a lot of people who went, but I attended one of those, and that sort of helped me further realize that, yes, I wanted to do medicine and learn about the human body a bit more. And then a few other things was I used to write a lot of articles for my school, and I was one of the prefects for like the school newsletter. So writing and that kind of stuff was a bit unique to me. And I did English, whereas a lot of people applying for medicine, I think, do biology, chemistry, maths, or biology, chemistry, maths, and physics. So mine was slightly different. So I was able to talk about my writing, which I then thought I could use when I come into medicine for research. So that's how my experiences were a bit more unique. My hospital work experiences were basically secondary care in obs and gynae, and in neonatal care, so newborn babies. And then my primary care work experience was in a GP practice. It was mainly doing filing and like medical note stuff, and then seeing a few vaccinations being done for babies, and that kind of stuff. So that was literally it. So I think the hospital work experience wasn't really that unique, but the other things I did on top of that, like the revitalised volunteering and then the anatomy stuff, and all of that was a bit more unique. What's the difference between work experience and work shadowing? Essentially the same thing. If you're a year 11, year 12, or a year 13 student, you're going to be shadowing. What they mean by work experience is more, I guess, being hands-on, which they won't really let you do because obviously you're not a medical student or a doctor. You'll basically be just observing or shadowing. So shadowing essentially just means observing what a doctor is doing. So you're merely just seeing what's happening around in the hospital or the GP practice. Is volunteering abroad in a foreign country doing work experience there considered highly in your personal statement? It's probably considered the same as if you were doing work experience here. It doesn't make you, it doesn't earn you extra brownie points or anything. Work experience is work experience. I guess the one advantage of doing it in a foreign country is you will be able to compare their healthcare service to the NHS. And that's something you can discuss in your interview or your personal statement as well. Does working in a daycare count as work experience for medicine? Yes, it does. Is participation in an online course that has to do with medicine considered highly? Not highly, I would again say along the same lines, but obviously the way you talk about that course is what matters. It doesn't matter what you do, it matters on how you reflect on it and what you learned from it. Do we need to make a profile with certificates of work experience and extracurriculars? No. For work experience, they might check, so they might ask you to give them the details, as in like the phone number or the address or the email of the people that you did your work experience with, so that they can liaise with them and check that you actually have done it. Because I think in the past there have been a few medical students a few applicants who've claimed that they've done work experience when they actually haven't. So they do double check. So they will want the email address of the person who you did the work experience with, but they're not going to ask you for certificates. Get a proofreader as well for personal statements. Usually this is like a teacher at your school that you're happy with them reading to your personal statement. For me, it was my English teacher and my mum. They both looked at it and sort of just proofread. So ask a family member and then ask someone from school. Does the requirement for work experience change for graduate entry medicine? I'm not too sure, and I think it's probably worth checking the university website, because that will depend on the university, and different graduate entry universities do it differently, so you have to check on the website. What if the work experience is done virtually? That's classed similar to if it was in person. What do you prioritize in your personal statement? Extracurriculars, supercurriculars, or work experience? All of them. You have to talk about all of them. The first paragraph should be about what sort of created that initial spark into medicine. Then you need to talk about work experience in your second and third paragraphs, second, third, and fourth paragraphs. And then your final paragraph, or your second to last paragraph, should be extracurriculars and extracurriculars alone. Because the hobbies is only a small paragraph, and then your conclusion is usually one line. Okay, I'm going to answer the rest of the questions in a bit, just because we have a lot to cover. So what kind of things to include? That's essentially what I've just summarised now. So first bit you need to talk about is your motivation for medicine. So what interested in you in a medical career? And then what were your developing interests? So was that you learned something in biology that really made you think, okay, I want to learn about the human side of biology, and that's kind of what's interested me, and I know medicine is that sort of a career, so that's why I want to do this. Was that your developing interest? Did you have a personal experience yourself with healthcare? Did a family member have an experience with healthcare which inspired you to study medicine? So what's your motivation? Then what did you do in order to further understand or further explore the interest that you initially had? So that's where you start talking about your work experience in your second and third paragraphs. Alongside work experience, you also talk about supercurriculars. And then the final paragraph will be on hobbies. And throughout the entire personal statement, you need to be talking about the strengths and the skills that you've developed through this entire journey into medicine. So a personal statement is showing your journey into medicine. So what was your initial interest? How did you develop that interest using work experience and supercurriculars? After doing your work experience, you must have realized that medicine is quite a stressful career. So how are you going to balance that? So that's where your hobbies paragraph comes in, and then talk about your strengths throughout. Okay, so in terms of layout, as you guys already know, it's 4,000 characters. Obviously, this might end up being a little bit outdated by the time you come to apply, only because, as someone asked before, there might be making some changes to personal statements. We still wanted to stick with this information because at the moment, this is what the UCAS is currently saying. So unless they change it, we didn't want to give you any information that we didn't know about, or leave you in the dark. So this is the current information that we have. So 4,000 characters. Do a brief introduction, talk about your motivations, talk about your experiences and skills. So that's your extracurriculars, that's your work experience and your supercurriculars. Then talk about your hobbies, which are your other interests, so the extracurriculars. And then your conclusion. Conclusion needs to be 1 or 2 lines maximum. You do not need to do an entire paragraph like you do for English essays. It's not relevant, and you only have 4,000 characters. What I mean by characters is every space counts as a character, every punctuation mark counts as a character, and every letter counts as a character. So realistically, you're writing about, I think it's about 26 or 27 lines. I can't remember how many exactly, but have a look on the UCAS website and it should tell you. So there's not much, not many, words that you can write. So you need to be really concise and you need to use your words carefully with your personal statement. Okay. Do you recommend summer schools in year 12 summer since it's already busy? Summer schools are useful, I guess, to help you develop especially skills on how to write personal statements and things like that. It really depends on how you manage your time and whether you think you'll still be able to do everything and revise for UCAT and BMAT and all of that stuff alongside doing some schools. So it's personal preference. So how do you go about talking about motivation? So as I said, talk about, what personal experiences you had in terms of healthcare and any unique reasons as to why you want to study medicine. So the unique reasons, I can't specifically give you any examples because it will be unique to you, obviously. For me, it wasn't really that unique. It was more, I just developed a very, very big interest in learning about human biology and particularly about the cardiovascular system. When we did heart dissections and things like that, I found it really interesting. And then lung dissections at school. So that was the main reason why I wanted to study medicine. And then to pursue that, I did some work experience, realized, yes, I do actually really like this career, and that's why I applied to medicine. So yeah, after you've identified your reason, you need to talk about how you developed that motivation. So this is when you do your work, talk about your work experiences and things like that. Try and keep it very short and concise, as I've said it before as well. In terms of talking about other experiences, try and break it down into different examples. So with work experiences, I think a lot of people tend to be really generalized, which I don't want. I want you guys to be specific when you're talking about work experiences. I don't want you to say, I did GP work experience and I learned that it's really important to have good communication skills, because literally anyone can say that and that doesn't make you unique at all. What would make you unique is something like this. So if you say, during my work experience, on one of the days I sat in on a clinic with one of the GPs. There was an elderly lady who came in who was extremely worried about having a lesion on her skin, which had changed recently. She was particularly worried about skin cancer because her sibling also had it. And the doctor used really good communication skills in order to explain that her symptoms didn't indicate cancer, and she was able to reassure the patient. This showed the importance of having good communication skills in order to reassure your patients, but also show empathy because they were quite, distressed. So you're sort of focusing more, rather than generalizing what you've seen, you're focusing more on a specific patient example which had an impact on you. And that's why it's really important to have a work experience diary whilst you're doing your work experience. Because as soon as you see a really good example of a doctor interacting with a patient, you can immediately write that down. So then when it comes to writing your personal statement, all you need to do is open this work experience diary and think, okay, I want to include this, and this work experience, this, and this example, from my work experience, in order to show why I still want to pursue this career and what's continued to inspire me to pursue medicine. Always reflect, talk about what you learned, talk about individual situations, as I've just said. So specific patients, be specific, because the patients you see are not going to be the same patient another applicant sees. And that is what is making you unique compared to someone else. And you absolutely need to do this if you want to be considered for an interview. Cut unnecessary details. So obviously the way I explained it, I did talk a little bit extra about the skin lesion and the fact that her sister had it or something. You can cut all of that down and just say, this lesion was extremely distressing to the patient. However, the doctor was very good at showing empathy and trying to understand the patient's perspective, but also offering reassurance and communicating with them that this was not the case. So try and, be concise as well. The first time you write it, you'll probably write like a whole page for one example. Then you need to cut down and cut down and cut down. And that's why starting writing your personal statement very early on is important, because it will take a very long time to draft it. So be careful, how much time you give yourself to write your personal statement. Don't do it last minute. Prioritize which examples to use, which examples not to use. So for example, if you had observed a doctor breaking bad news to a patient that they had cancer, and it had a massive impact on you, but you also had an example of a patient who had diabetes and they had an ulcer, you need to sort of prioritize which example would maybe give you a little bit more to talk about, because it's about quality, not quantity. So think about the quality of your examples and choose the one which I guess gives you a little bit more depth for your personal statement. So you do have to prioritize which examples to use. You won't be able to use all of the ones that in your diary in your personal statement. Okay, so this is an example. So I spent a week in a hospital shadowing doctors and nurses. I saw a dermatology clinic and spoke to patients. Now, what do we think can be improved with this one before I go on to the next slide? Hang on, let me see if the chat is, okay, chat should be enabled now. So you guys should be able to type in the chat. Yeah, what you spoke to the patients about. Yes, you're right, Katie, it's too vague. There isn't any emotion, needs specific examples. Yeah, you're all correct. So what could be improved? So the way it could be improved is this. So on work experience in hospital, I had the opportunity to speak to patients. One in particular, I would even make this a bit shorter. So I'd say one in particular had, I don't know, X condition. While speaking to them, I realized the importance of, whether that's communication or teamwork or whatever, used in consultations. I realized I was a strong communicator and demonstrated this by, I don't know, reassuring the patient. I was surprised when I struggled with certain skill. And so following this, I decided to become a healthcare assistant in order to further develop my communication skills, something like that. So constantly showing how you're working on your own skills from what you learned from your work experience in order to do better and be better, basically. Okay. Moving on from personal statement, going into interviews and what you can do in an interview to make yourself stand out is talking about yourself. I think a lot of people find this really difficult. It's hard to talk about yourself and not feel like you're boasting. But in an interview, you need to show the confidence and you need to be able to be comfortable talking about yourself. So to get to this stage, you need to practice doing interview questions before the actual interview. So how do you need to talk about yourself? Try not to be too humble. I know I said earlier, try not to be arrogant, but at the same time, you shouldn't go too much the other way either and be too humble. You do need to find that comfortable middle to show you're confident and showcase your skills, because otherwise you won't give yourself a good enough chance to get an offer from an interview. Whenever you're talking about something, back it up with examples, and that's the way to avoid sounding arrogant. So if they say, tell me a time where you've showed good communication skills, you need to talk about examples. So I've showed good communication skills in X, Y, and Z settings. From this, I learned this, and on reflection, this is what I will take forward when I become a doctor or when I get into medicine. So always reflect and back up with examples. It's the way I describe it for both personal statements and interviews. When you're doing your English essays, you make a point, you give the evidence, you explain the evidence, and then you link back to why you want to do something, or you link back to the question. So here you're trying to make the point, you're giving the evidence from your work experience or from your hobbies or from your supracurriculars. You are explaining the skills that you learned from the evidence that you've just mentioned, and you're linking it back to why this example and the point that you've made would make you a good doctor in the future. Because the whole interview and the whole personal statement is a persuasion process where you're trying to persuade them to give you a seat at their medical school. Talk about your experiences, as I mentioned, what makes you you. So that's essentially the whole point of an interview. And be comfortable talking about your weaknesses. Again, people are not comfortable with this, but you do need to practice getting comfortable with talking about your weaknesses. The way to do that is mention a weakness, but then turn it into a strength, or turn it into how you're working on that weakness at the moment to make it into a strength. So you need to be able to be comfortable talking about both good things about yourself as well as bad. So how do you talk about weaknesses? So you can either frame it as a previous weakness, as in it's not a current weakness of yours, it's something that you struggled with in the past. So for me, it was public speaking. And I talked about how when I was younger, doing presentations and things like that at school was something that was really difficult for me. But then in year 12 and year 13, having attended conferences and having attended different sort of medical school stuff, it really helped me to develop my public speaking skills and communication skills. And even my work experiences helped me communicate with a lot of different types of people as well. Okay, so someone's raised their hand. Is there a question? Or not? If there is, put it in the chat. And from the previous weakness, what actions did you take and how have you improved that weakness? Oh, someone keeps raising their hand. If you have a question, put it in the chat because I can't unmute anyone because this is recorded. So try and put it in the chat. And how are you continuing to improve on that weakness and continuing to turn it into a strength? Okay, the other things to think about are, whenever you're thinking about work experiences, think about what positive situations you've noticed and any negative situations that you've seen in your work experience. So it's not always going to be good things that you see in hospital. Sometimes you're going to see doctors really stressed. You're going to see them have difficult times, and that is going to be your day-to-day work when you become a doctor as well. So acknowledging both the positive and the negative sides show that even though you understand that there are negative stresses to the career, you still want to pursue it because of whatever reason is unique to you. They might also think, they always will ask, why do you want to study at our medical school? You need to have a good understanding of how they run their medical school, what their course structure is like. So you need to do research. All of this information, there's no excuse to not do well in this question, because all of the information that you need to talk about is on their medical school website. So if they will check to see if you've read that properly or not. So definitely make sure that you have, and you've prepared a good enough answer for that. So, for example, what kind of questions can they ask you? They can ask you why medicine. Again, there's no excuse not to prepare for this question either, because this question will be asked universally at most medical schools that you interview at, or some variation of it. Why at University of Manchester or University of whatever, you can insert any university there. You have to be prepared, because different universities use different course like structures. So Bristol, for example, we use CBL and lectures, and we use system-based learning. We teach our anatomy through prosection, not through dissection. And then we also do the first 2 years, which is preclinical, and the last 3 years, which is clinical. And between years 3 and 4, you can intercalate. You can either intercalate in Bristol or go to a different university. And other things in terms of the university itself, we get clinical experience from the first week of first year. So that's something that was an important factor for me. I wanted early clinical experience. Then they will also ask you about what hospital placements they have. So in Bristol, there are 2 Bristol hospitals, Western, Bath, the 2 Somerset hospitals, Swindon and Gloucester. So those are the different placements you could go to. So having an understanding of those placements is important as well. Okay, I think there was another question. How would you answer why medicine, not other allied medicine subjects? So the way to do that is not to say anything negative about other professions like nursing, but to say that I guess doctors sort of have the final say in terms of what kind of treatments are offered to the patient. Nurses do, some specialists or advanced care nurses do tend to have a lot more input into what happens with the patient now compared to in the past. So they tend to do very similar roles to what a doctor does, but the doctors still do make the final decision making depending on the specialty you're doing. And it's having that sort of leadership skills, and also having that overarching medical knowledge of all different medical conditions, even if you're specializing in just one area. Whereas with nurses, they will specialize in one area, but may not know as much about the general workings of the entire body. Whereas doctors, obviously, we learn about every single body system. So even if we're only in one specialty, we can still consider other areas and offer certain types of treatment for some patients over others. So that's the difference. Okay, communication stations can come in the form of role play. Role play is something that a lot of people don't like. Essentially, all role play is testing you on as your communication skills. Be calm, because these stations are not as hard as you may believe. All they want you to do is to just show empathy and just show your communication skills and be able to break bad news, even if you don't do it 100% well, because they don't expect you to be amazing at it. They just want to see whether you can show your empathy and let the actor show their emotions, and then you being able to give them the space to be able to show that emotion. Be compassionate. Think about what you will say before. This is a good piece of advice, but I wouldn't say overthink it, because then that can make you worry more about what you're going to say during the role play station rather than actually listening to what the actor is telling you. And always the actors are trying to give you hints and trying to allow you to do well in these stations. So listen really carefully to what they're saying, acknowledge their emotions, and be empathetic. So breaking bad news is a very common situation. So that could be medical or non-medical. A medical one could be quite a mean one to give you guys, because obviously you haven't developed those skills to understand like medical conditions, but they may ask you to break bad news to a patient and say to them that they have cancer. That would be a really harsh one to give you, but they might do it. And a non-medical one could be that maybe you were looking after a neighbour's pet and you've lost them over the weekend and you have to break that news to the neighbour. So regardless of whether it's a medical or non-medical scenario, the structure is the same. You break the bad news, you have to do it as bluntly as possible, and then offer empathy and apologise. That's essentially the whole structure of it. And it's just being human. They're just testing your ability to show your emotions and understand other people's emotions. Be honest, so be blunt and be honest. You can't beat around the bush. So for example, if you're breaking the bad news and saying someone has cancer, you can't say, we think it might be cancer. Do not use maybe language, use absolute language. So say, from your results, it is cancer, not from your results, it seems like it's cancer, because seems has different connotations. So be blunt and say it is cancer. And after you've said it, give them some space to show their emotions or process through their emotions. One model that you can follow is the spikes model. So SPIKES, and each of the letters stands for different things, and it's a structure of breaking bad news. Look that up in your own time, and think about pacing. So as I said, give them, a lot of people feel like they need to fill the silence in role plays. You absolutely do not need to do that. Just break the bad news and then go silent and let them think and let them talk and process their emotions. Chunk and check, so give the informations in small chunks and check that the person that you're speaking to is understanding what you're saying when you're breaking the bad news. Because usually when you break bad news, people listen to the first thing, they listen to the word cancer, and then after that they don't hear anything, they don't listen to anything else you're saying, because it's such a big shock to them and they're still trying to process the fact that they have cancer. So break it into small chunks, pace yourself, and then check whether they've actually heard you and whether they understand what's going on, because a lot of people, it goes over their head completely. Real patients, so obviously be compassionate, let them talk. That you wouldn't really get a real patient for a role play. You will usually be an actor. But the best way to try and pass the time is to let them talk and say less. What you want to show is active listening. If you let them talk as well, it's another way of them giving you hints as to what other questions to ask, because you'll hear them say, oh, I'm really worried. I think it might be cancer. This is even before you've broken the bad news. If you just say to them, what do you think's going on? Then they might say, I'm really worried. I think it's cancer. I have spoken to my family about it already. They're a little bit more worried than I am. Then when the way you break the bad news can also be altered to the person you're speaking to. So the actors always give you hints as to what question to ask next or what to say next. So use them. Don't over medicalize, so do not use any medical jargon. So if it's like a cancer of specific cell type, patients won't really understand that. You don't really need to tell them that. All you need to say is this is lung cancer or this is X cancer, whatever cancer. You don't need to say this is what we did. We looked at the cells under a microscope and this is what we found out. They're not going to be listening to you. So just be very practical with the language you're using. Show empathy, obviously. So for example, one of the questions you might be given is speak to this real cancer patient about their experiences. So they already have cancer, you're talking to them about their experiences. So you can start by obviously saying, checking their name and their date of birth and then introducing yourself. And then you can sort of say, I understand you have cancer. Can you tell me a little bit more about that? So that's a really open question to then allow them to speak for a few minutes. And you've already, done 3 minutes out of the 5 minutes of the station, for example. And then the last 2 minutes, you just ask them a few more questions about their cancer and how it's affected their quality of life. And that's it. That's the role play. Another one, a non-medical one, would be tell your neighbor that you've run over their cat. So slightly different scenario, but same sort of approach as what we've gone through previously. Okay, in terms of ethics, ethics and decision making. So ethics stations, again, is one of the hardest stations, I would say, that people do tend not to do so well on. It's really important to read over the 4 ethical principles and then not just learn what they are, but also know how to use them in different ethical scenarios. So try and remain calm with ethical stations. I always say, Start talking about it in a balanced way, and then in the end, when you come to your conclusion, that's when you give a decision. You don't just choose a side immediately. You always have to start off talking about both for and against, and then making a decision at the end to show your thought process. So these ethics stations are almost like showing your maths working out. So similar to that. As I said, balance arguments, avoid your own opinions until the end, have a good background knowledge of these ethical concepts. So that could be things like abortion or euthanasia, or it could be, what were the other ones that I got asked? I got asked about Jehovah's Witnesses and blood transfusions and life-threatening treatment. Another thing could be contraception in an underage girl and how you would approach that situation. So those are common scenarios. So what do you need to know about ethics stations? You need to know about consent and what consent means. So whenever whether that's you're speaking to a patient or whether you're examining a patient, you always need to ask for consent. In terms of consent in this context with Gillick's and Fraser's competence, they're referring to contraceptive pills. So usually the scenario will be something like a 14-year-old girl comes in asking about contraceptive pills. What are you going to do in this situation? Well, first of all, because she's underage, you can't assume that she has competence. So you would need to assess their Gillick competence against the Fraser guidelines and see whether they're competent enough to be able to ask for the contraceptives. And if they are competent, even though they're underage, then you would just give the contraceptives. If they're not competent, or you're worried about some sort of sexual abuse going on or abuse within the relationship, then or coercion or trafficking, then you would assume that this person doesn't have competence and you would have to report it. So that's the kind of scenarios that Gillick's and Fraser's competence would come under. Another way Gillick's and Fraser's would come under is if a young patient, like a 7-year-old boy or an 8-year-old boy or girl, has cancer, but their parents don't want the doctors to tell the boy that they have cancer. So we have to determine whether the boy is competent enough for us to tell him the diagnosis, because legally we're not allowed to keep diagnoses away from the patient's knowledge unless there's a good reason for it. Other things to think about: capacity. So capacity goes alongside competence. So capacity is the ability of a person to understand what's going on with their treatment and with their health in order to be able to consent to things that is going to be done for them. So for example, a person who has dementia might not be able to retain the information that you're telling them to decide whether they want X treatment or Y treatment. So in that sense, they won't have capacity to make the decision and consent to treatment. And in that sense, someone else would have to make the decision on their behalf, whether that's the doctors or a legal appointed guardian. Whereas most people over the age of 18 are assumed to have capacity, unless proven otherwise, like in the case of dementia. But as we said with Gillick's and Fraser's competence, if someone is underage, some of them can still have capacity, so we always need to assess it as well. The 4 pillars of ethics. So does anyone know what those 4 pillars are? If you can put it in the chat. Do you have to reach an answer in ethics questions? That depends on the ethics question. So for example, with euthanasia, probably not. But with organ donation, whether you're going to give the organ to patient A or patient B, yes, you do have to reach a conclusion. Is it true that BMAT unis have your BMAT essay in the interview and can ask you questions about what you wrote? Depends on the university. I think UCL does, but some other universities don't. So you'd have to check individual universities. Okay, I think I've got a mixture of the right things. So the 4 ethical pillars are autonomy, beneficence, non-maleficence, and justice. So autonomy, it links very closely with capacity and competence. So autonomy is the right for a patient to know what's going on with their health, and the right for a patient to say yes or no to a treatment. The one thing with autonomy, if you are under the age of 16, you can accept treatment, but you can't refuse treatment. So only full adults can accept and refuse treatment. But if you're underage, you can't refuse it. You can only accept treatment. Beneficence is doing good for the patient, so acting in their best interests. Non-maleficence is not harming patients. So beneficence and non-maleficence go hand in hand, and justice is fair and equal treatment for everyone. So that justice would come under when we're talking about problems like organ donation. Who do we give the organ to? Professionalism obviously fits under ethics and confidentiality. So confidential, any information that's been shared between a patient and a doctor needs to remain confidential, except in 3 situations. So if the patient is at harm to themselves, if the patient is at harm to immediate family members, or if the patient is at harm, if the patient is at risk of harming general public. So patient at harm to themselves would be things like self-harm, suicide, mental health issues, poor care, poor self-neglect. If it's a patient harming nearby family members, domestic violence, or if someone is harming them, and that's an example of that. Or if the patient is at risk of harming the general public, so that could be someone who is really violent, or who has a mental health illness like schizophrenia or something, who are quite violent as a result of it. Or if they have a communicable disease like COVID and they're not following guidelines and they want to go out and spread the disease, or other things like meningitis. Again, those are all communicable diseases. If they're not listening to what you're saying and they're just carrying on going outside, that's a risk to the public. So there's the 3 cases where you can break confidentiality. And then accountability, so being accountable as medical professionals is an important ethical consideration as well. Okay. So when it comes to making decisions, make sure you have a clear answer. Have a good structure. So if you're talking about abortions, make sure you mention pro-choice, and then you discuss pro-life arguments. And then you come to a conclusion as to which side you agree with and why. When you're talking about pro-life and pro-choice arguments, make sure you incorporate those ethical concepts in there. So for pro-choice, you are thinking about things like autonomy and beneficence for the mother and non-maleficence for the mother, whereas with pro-life arguments, you're thinking about non-maleficence to the baby, and also the concept of justice. So remember which bits of the ethical pillars to talk about in which sections of your answer. Make sure your arguments are balanced, as I've said before, and make a conclusion. So whether you're pro-choice or pro-life and why. So summarize at the end. So, for example, if you have a question like you prescribed the wrong medication and a nurse has gone to administer it, what should you do in this situation? So obviously talk about first maybe approaching the nurse and making sure that they haven't administered it yet, and then apologizing to the patient and explaining what has happened and making sure to reassure that patient that it's not going to happen again. And then going, because obviously you want to maintain beneficence and non-maleficence, not doing harm to the patient. And then maybe taking the nurse aside and speaking to them and talking about how this mistake cannot happen in the future and how this will ensure sort of fair and equal treatment for everyone else. So that's agreeing with the concept of justice as well. Okay, you can get asked some weird stations. This is, it can vary depending on the university. It's not just Oxbridge that can ask you weird stations. Other universities can as well. So with these questions, you can't really prepare for them like the ethics ones or the motivation questions, because you don't really know what to expect. So they could ask you a lot of different things. What they want to test is your logical thinking. So try and just answer the questions in the same structure you would for your general interview technique, and use knowledge and previous skills from what you've learned in your general interview coaching in order to do well in these stations. Sometimes the answers that you give, you might not be fully satisfied with it, but make sure to not let it affect the performance in other stations. So a common problem people have in MMIs is if they do badly in one station, they keep thinking about it in the remaining stations, which means they're not paying full attention to those other stations. And as a result, all your marks from when you did badly on that one station tends to go down, which obviously increases your risk of not getting a place in that particular medical school. So as soon as you've had a bad station, forget about it and move on to the next one and place your full focus on the next question, because otherwise you will shoot yourself in the foot a little bit. So, for example, the way an MMI could run is you might have, a weird question could run is they could ask you 21 questions. sort of game, or they could ask you to describe an image. So describing an image was done in Bristol for my year, where there was a skin lesion and you had to describe it as if you were a junior doctor and then sign and date it as if you were writing in the medical notes. So that was one of my stations. You might be asked to talk about what do you think are the average number of words in a book. Obviously, you won't know off the top of your head, but it's just important to show a little bit of your logical thinking, saying a typical book has about 300 pages. If each page had about 100 words in it, there would be X amount of words or something like that. So just talk through it in a logical way. Other things that you might want to consider, make sure not to forget about UCAT preparation. I think a lot of people tend to leave this a little bit late. I would ideally say start it in 1 or 2 months. I'd say 2 months is a good time to start revising for it before your exam date. So my exam was in the last day of August, and I started revising, I think, end of June, beginning of July. So I had a month and a bit, which maybe wasn't enough time, but it obviously depends on how well you revise and how you sort out your revision time. So you can get it done in a month and a bit, but obviously some people might need more time, some people might need less. Make sure that A-level results are obviously your main determining factor. So even if you've got a place at medical school and whilst you're revising for your A-levels, and then you get your A-level results and you don't do as well as you thought, you might not end up with a medical school seat. So be really careful with prioritizing. So the main thing is your A-level results. So even if, don't feel disheartened if you don't get in via the interviews or anything. Once you've secured the A-level results, you can reapply the next year and feel more confident because you already have your results with you. So it's not the end of the world if you don't end up doing well in your interviews or your personal statement or your UCAT. As long as your A-level results are there, that's the main thing. And then know what your medical school is looking for. Different medical schools look for different things. So obviously places like Imperial, a lot more research heavy than other universities. So if you're applying there, make sure you know you're up to date with the current medical research or what that specific university are doing their research on, and maybe talk a little bit about that because it just shows your interest and shows your passion towards that medical school. But above all, the main thing is to be yourself. Don't try and say you've read certain books which you haven't read, or did certain things that you haven't done, because you will shoot yourself in the foot. Just be yourself, be honest, and try your best, and that's the main thing with interviews. Okay, so I think there was one more question which I said I'd address at the end because it wasn't really relevant to the main presentation. So it was, what did you intercalate in? So I intercalated in endocrinology, so medical sciences with endocrinology was what my degree was. So endocrinology is everything to do with hormones, so the pituitary gland, the thyroid gland, the pancreas, the any cancers which release hormones, and yeah, every hormonal organ, basically, the parathyroid glands, what other hormones are there, like your ovaries, testes, that kind of stuff. So we were looking at all of the hormones across the body and how they work, and the gut hormones as well. My dissertation was on cancers and how certain types of cancer treatment can cause patients to have endocrine side effects. So that was my dissertation. Very interesting degree if you're interested in hormones. I would recommend. It's obviously a really good, Imperial is a really good place to do endocrinology because they have the main research in that university is endocrine stuff. So if that's something you're interested in, I would recommend Imperial because the teaching is really good there for endocrine stuff. How do you think is the best way to revise for UCAT? Doing lots of questions, doing it under timed conditions, and then the main thing is going over what you've got wrong, because I think a lot of people just skim through it. You really need to sit down and spend a lot of time thinking about why you got that question wrong and trying to understand the reasoning for the right answer. What would happen if your predicted grades are lower than what you need? A, B, so you don't get an offer, but your actual A-level grades are higher. You'd probably have to reapply the next year. I think some people have got in the past through clearing. I don't know how successful that is. That's something you can try, but most people end up reapplying the next year. Do they ask about books you read in interviews, or is that for your personal statement? They can ask in the interviews. Recently, what a few universities have done is sent students an article within like 2 days before their interview, and then they ask them questions on that, just to standardize it. But yeah, if you want to mention it in your personal statement, just make sure that you absolutely know what you're talking about, and if they do ask you questions on it, you can answer it. Usually in an interview, they don't have your personal statements in front of them. They just ask you questions based on a standardized set that they've created, because otherwise it's really difficult to score all of you. Would it be possible to get into medical school by calling on results day for places? Yeah, that's what clearing is. Not a lot of medical schools do clearing, but you can ask. I'm not sure how successful it is though. Is it worth doing Olympiads in year 13 after submitting your personal statement? Yeah, just because you've submitted your application doesn't mean you stop doing stuff. So even after I submitted my application, I did do a lot of volunteering, continued to do it, because I was then able to talk about it in my interview. So yeah, you can. Are there any books you'd recommend reading about medicine in general? I didn't really read that many because I don't like reading a lot of nonfiction. I didn't read any books. Ones that are commonly read by students wanting to apply to medicine are This Is Going to Hurt, which a few of you might have heard of. And also The Man Who Mistook His Wife for a Hat. That's about dementia and like a lot of neurological diseases. And then there's I think When Breath Becomes Air, that's a good book to read as well. But have a look online that, in Oxford University, they have a reading list. Have a look at that if you really want to. Do you recommend doing an intercalated? Yeah, it's personal preference. For me, I wanted to learn a lot of research skills and how to write scientific papers, and I wanted to have a chance of publication and stuff like that. So yes, it was beneficial to me, but for some of my friends, they just wanted to graduate and start working. So when you're doing a 5 or 6 year degree, it depends on what your, I guess, what your priorities are. For me, I wasn't rushing to start work, so I was happy to take the extra year, whereas some other people didn't want to do research, and some people don't like research, so they ended up thinking that intercalation was a waste of a year, so they ended up not doing it. So it is personal preference. Is work experience in a lab good? Yes, it is. It still teaches you a lot of skills. Is an EPQ beneficial? Not always. So some universities look at it, some universities don't. It's really whether or not you want to do it and what you get out of it. Again, it's similar to an intercalation. It teaches you certain skills, but it's not for everyone, and it may not necessarily come up as a question in your interviews. Okay, one more. Do you have an advantage if you take 4 A levels rather than 3? No, not necessarily, no. Because the minimum requirements for them is 3 A levels. So anything extra you do on top of that is just an extra. It's not anything else, unless you're applying for somewhere like Oxford or Cambridge, where they will look at all your 4 A levels. If there are no more questions, feel free to go. But if there are questions, I will stay on for another 2 minutes. No problem. No problem. if personal statement format changes for next year, what is it likely to be? As I said, I think what they're thinking of is giving you guys 3 questions, and then you write like short answers to those questions. I'm not sure yet though, so keep checking the UCAS website is what I'd say. Okay, I'm going to end the talk now, but thanks everyone for attending, and hopefully see you guys in the next 2 weeks for the next session.